Hi, so today we're going to be giving injections. I'm going to begin by looking at the MAR. So my patient is Mr. Mancini. He's been diagnosed with congestive heart failure. So the doctor has ordered heparin 5,000 units subcutaneously and Haldol 1 milligram IM. So before I continue, I want to make sure that the order is clear, complete, and accurate. So we have all the information that we need here, including the patient name, diagnosis, and allergies, which include codeine. And then I want to make sure that it's appropriate to his diagnosis. So heparin is a medication given to prevent blood clots from forming due to blood pooling. And then Haldol is an antipsychotic, which will help eliminate any agitation or anxiety in the patient. So moving on, before you give any medication, you want to make sure that you check the 8 rights of medication, including the right med, the right time and frequency, the right dose, route, patient, the right to refuse if you didn't want the medication, the right reason, and when I'm done, I want to document everything. I also want to make sure that I have his medication and health history. I want to inspect that, see if there's any contraindication to what we're doing, none of which are evident, so we're okay to proceed. So I want to inspect my patient. I want to look at his body build and muscle mass. So I've noticed that he does have a slim body build, but his weight appears normal for his height, so we're okay to continue with our equipment that we have here. Finally, I want to let you know a little bit about the equipment that I have in front of me. Subcutaneous injections are performed using the smaller of the 2 needles, and that's just based on the volume to inject and the type of medication. And because we are going only into fat, compared to IM, we're going to want a longer and a wider needle because we're going directly into the muscle tissue. For subcutaneous, we're going to be using a 1 to 3 milliliter syringe with a gauge of 22 to 27, and then intramuscular 2 to 3 milliliter syringe with a 21 to 23 gauge, both of which are quite small. We want to be very precise in what we're doing. So I'm going to perform hand hygiene. And assemble my supplies before I bring it to the patient. So I'm going to open my subcutaneous syringe. And because we are withdrawing from a vial, I need to attach a blunt needle. So I'm just going to luer lock that in. Perfect. I can discard that in my garbage. And I'm going to be aspirating the amount of air of the medication I would be injecting, which is 1 ml. So I'm going to pull back on the syringe to 1 milliliter and take off the cap. So I do want to alcohol swab the vial that we're going to be using in an inner to outer fashion and let that dry. Now that I've kept this here in the little house in my sterile field, I'm going to aim for the bullseye and inject the air into the medication, followed by withdrawing 1 milliliter of the medication that we're going to be giving. Okay. Now, because we are giving heparin, we want to be very precise. So I'm going to read on the syringe that we're giving 1 ml. And to get rid of any air bubbles that could be in the syringe, I'm going to give it a little flick. Now that I'm done with the blunt needle, I'm just going to recap it by putting it back into the house of the needle, followed by removing it. And this can go into my sharps container. So, before I bring the medication to the patient, I want to ensure that I have the name and room number written on the packaging. And I'm just going to add the subcutaneous needle. By locking it into the syringe. And now that it's labeled, we're good to go to the patient's room. So now that I'm in the patient's room, I'm going to introduce myself, let him know my name, that I'm a second-year nursing student, and I just want to perform hand hygiene before putting on my gloves. I'm going to be putting on my gloves. And today I'm going to be using some gauze. So I have that here, just 2x2 gauze. So I'm giving a sub-Q injection today. So I just want to make sure that I landmark appropriately. So today we're going to be going in the abdominal area. I could ask the patient which side he would prefer. We could either go to the back of the arm or the inner aspect of the thigh, the outer thigh. But he said that he wanted to have it in the abdomen today, which is fine. The important thing though for landmarking that I want to be 2 finger widths below the umbilicus, and I don't want to go any higher. So now that I've landmarked accordingly, I am going to open my alcohol swab, and I'm going to clean in an inner to outer fashion. And I can discard of the gauze, of the alcohol wipe. I'll let that dry briefly. I don't want it to sting when I do it. And because we are giving heparin, this will be at a 90-degree angle. I want to have my gauze in my non-dominant hand, ready. And I can take the cap off of the syringe. Perfect. And because we're doing a sub-Q, I want to pinch. And I'm going to go in at a 90-degree angle and slowly inject the medication, doing about 0.0 milliliter per second. Perfect. Now that I'm done, I'm going to bring up my gauze, place it at the site of the needle. And you never want to recap needles, so this will go directly into the sharps container. And because we did give heparin, I want to hold pressure for about 30 seconds to 1 minute. Perfect. And of course, I would document everything I give and have the patient ask me if he feels any discomfort or any issues after the medication has been given. So the next medication that we're going to be giving today is Haldol, and we're going to be giving 1 milligram, but this time we're going to be giving an intramuscular injection, so a little bit different. Now that I'm back in the medication room, I'm going to get my IM syringe, which we've already talked about. It's a 1 to 3 milliliter syringe, and I'm just going to grab the needle here, the blunt needle, to aspirate the medication. And today we are giving 0.5 mils of Haldol. Okay, and like always for a multi-vial container, I want to begin by cleaning the bullseye in an inner to outer fashion. And I'll let that dry briefly. Take the cap off my blunted needle and insert directly into the center. Just going to aspirate 0.5, insert, and inject the air into the medication. Now, I'm going to withdraw back 0.5 milliliters. And like always, you want to make sure that you're very precise in your measurement. So I'm looking at it here. I have 0.5 mils, and I want to make sure that I don't have any air bubbles. Perfect. So I'm going to place my needle back into the bevel cap and remove this aspect of the needle. Place it back into the little house. And now I'm just going to attach it to the IM syringe, which I've spoken about previously. And luer lock that in. And like always for any injection, I'm going to write on the packaging the patient's room number, name, and the medication, so I have all the information I need. And great, we're ready to go into the patient's room. So again, I would want to tell him, hi, I'm back here for your second injection today. I'd explain a little bit about Haldol, any of the side effects, what he could look out for. And because we are doing IM, I'm going to be going for the deltoid muscle. So there's a little bit more landmarking involved in that. But like always, I want to begin with my hand hygiene. followed by putting on some gloves. And now this IM injection will be given at a 90-degree angle, like all intramuscular injections are. The difference in this one being the landmarking. So I want to locate the clavicle and move up to the acromion. And from the acromion, I want to go about 2 to 3 finger widths down on the patient's deltoid. So I'm right in the middle of the deltoid. Perfect. And from this point, I'm going to open my new alcohol swab. And I'm just going to cleanse the area, moving in an inner to outer fashion. I can remove that in my garbage. Perfect. So I'm just going to remove the tip, the cap on the needle, and I'm going to flatten it and then pinch, making a Z-word track motion to ensure the medication stays in the muscle. So again, I'm going to insert at a 90-degree angle and inject the medication slowly. Because I have my gauze right here, I'm going to bring it to the site of the needle, holding it tightly and withdrawing. Because this is a sharp, I'm going to be disposing of it in the sharps container. And I'm just going to hold that for a moment for the patient, again reassuring him to let me know if there's any discomfort, and I'm going to check in on him in probably about half an hour to ensure there's no swelling or erythema at the site. So after removing my gloves, I want to again perform hand hygiene. And finally, document everything I've been doing today. So I want to document both the date and the time of the injection, that being February 12th at 7 o'clock. And I want to write down the name of the medication and the dose that I've administered to the patient. So heparin 5,000 units, Haldol 1 milligram, or 1 mil. The site administered, so today we did the lower abdomen and the deltoid muscle. And I want to notify if there's any adverse reactions, how the patient tolerated the medication, any additional information that would help in the future. But that's all for now. So